At one point, I kind of ran the numbers, and it was around a third of the patients that come into my clinic that were already on thyroid medication. Hey, it's Dr. Gayla. Today, we are going to focus on the thyroid. And if you are like many of the women that I see in my clinic, you may be concerned that your thyroid is a little sluggish, maybe even full-on malfunctioning. Many women that come into my clinic have already been prescribed some sort of thyroid medication to deal with a thyroid issue. At one point, I kind of ran the numbers, and it was around a third of the patients that come into my clinic that were already on thyroid medication. And so if you've been following me for any period of time, you know that I do not recommend taking any supplement or medication long-term. I'm not a medical doctor, and I will not get in the middle of a relationship that you have with your medical doctor prescribing physician. But if you have been on a medication for more than 3 to 6 months, I want you to go back to that medical doctor and ask if you really still need to be on the medication and if there are alternatives. Any sort of medication or supplement should be used in the short term to buy you some time to figure out what's really going on. One of the people that I follow referred to the thyroid as the canary in the coal mine. And I thought this was just such an awesome analogy because, if your thyroid is malfunctioning, your thyroid doesn't just malfunction. I mean, maybe 1 in a million are going to have a thyroid that truly malfunctions, but a third of the women in a certain age range all have a malfunctioning thyroid. There's something else going on. And so I want us to stop suppressing symptoms and get to the bottom of what's really going on. And so that's going to require that we take a different approach and that we be a little patient with our bodies, that we develop some awareness, and that we really learn how to be our own PCP, as I talk about in my book, What's Your Kryptonite? PCP is primary care practitioner in the medical world, but I want you to be your primary care person because you know best what's really going on with you and what works for you and what doesn't. So let me share a story with you. Let's call her Emily. Emily's been experiencing unexplained weight gain, fatigue, and a general feeling of being unwell. After multiple visits to her doctor, Emily was diagnosed with an underactive thyroid. And the story ends with, it's a common issue for women. And so I just explained to you how common it is. But there's just so much more to the story that we need to unpack here. So the thyroid is a small butterfly-shaped gland at the base of your neck, and it produces hormones that regulate metabolism. So if you watched last week's episode, we talked about metabolism and ways that we can fix metabolism. So you might want to go back and take a look at that before you turn to thyroid medication, because some of the things we suggest will also have a positive impact on your thyroid. But the thyroid regulates metabolism, body temperature, and energy levels. And so one of the ways we're going to check to see if our thyroid is functioning properly is by using the basal body temperature method. When I suspected that I was having an issue with my thyroid about, 15 years ago, I could not get to the bottom of it. And as you can probably imagine, like you, I get frustrated and so started poking around. And I discovered that one of the old school ways to check thyroid is to use basal body temperature. And for thyroid, one of the best ways to do that is axillary in your armpit. And so I share a clip from this video to help you understand how this is done and as we track our basal body temperature, we'll see how well our thyroid is helping us to manage our body temperature, which is highly correlated with our energy production and metabolism.
Body temperature is an awesome indicator of your overall metabolic health. Let me grab my thermometer. So what you can do is you can wake up in the morning first thing, put this thermometer right against your skin before you get out of bed, have it sit there for 5 or 10 minutes. Again, ideal body temperature for thyroid, again, is going to be 97.8. So thyroid equals 97.8 or higher. Ideally 97.8 to 98.2 for the armpit. If we're looking at our adrenals, we start knowing there's an adrenal issue because our adrenal temperature will actually fluctuate up and down greater than 0.3. It'll actually go 0.3 or greater. That's how we know there's starting to become an adrenal issue.
So when the thyroid gland's not functioning properly, it causes a variety of symptoms, including weight gain, fatigue, depression, and hair loss. So if you find yourself dealing with thinning hair, it could be long COVID, but it also could be related to your thyroid. And it also could be that toxicity left over from having a viral infection of some sort is also affecting your thyroid. And what you really need is to help clear some of that residual toxicity. And so I talk repeatedly and encourage you to figure out what kinds of toxins your body can't handle and have accumulated and are building up, and you do a targeted detox that addresses those specific types of toxins. Fortunately, there are some natural remedies that we can use to help support the thyroid. In my particular case, it became clear that I was low in iodine. And if you're having some other symptoms, things like bloating after meals, often we can tie that back to small intestinal bacterial overgrowth, or it's often referred to as SIBO. And so iodine can have impact in all of these areas. And so if you find that you're experiencing some of these other symptoms, you don't want to supplement with iodine unless you really need it. It's not something that we would supplement with just let's try it. But if you are low in iodine, it's something that you would need to supplement with. Again, in the short term, so that your body can just rebuild its stores until it has enough to kind of jumpstart and get everything going again. It should be able to produce enough iodine, or extract, I guess is a better way of saying it, extract enough iodine from the foods you're taking in. And so if that's not happening, either your body's not able to process everything properly. If you're not taking in enough iodine, you can typically adjust your intake of seafood, or even better, seaweed, kelp, or some sort of natural iodine-rich food source. Sometimes I will recommend that patients, at least in the short term, use a marine collagen that I stock here in my clinic, and that's going to have a lot of positive benefits for you if this is one of your issues. So we will supplement with food sources of iodine. The fantastic thing about using food sources to supplement is that that's the way our body's designed to get our nutrients. So when we supplement, we can never supplement in the exact formula, if you will, that our body needs to use the micronutrients. And so much better to get those micronutrients through food sources and allow your body to do what it does naturally and figure out needs a little of this, needs a little of that. It's going to, fill the tank on one thing and let go of what it doesn't need. Digestion naturally handles the rest of what we don't need. And when we take in supplement form in an unnatural way, Again, we may need to do it on the short term just because we've got a deficiency that's so great that we need to fill an abnormal gap, but we don't want to do that long term because we want our bodies to get those nutrients from what we're consuming. So if you feel like you have done what you know needs to be done and you are taking in enough iodine and you're getting your selenium and you're still feeling like you're experiencing symptoms of weight gain or fatigue or hair loss, then it's probably some toxicity. We've already mentioned this, and I just want to encourage you to reach out. You can visit my website at drgala.com to learn a little more about how you might get to the bottom of what's actually the root cause of a sluggish thyroid for you. And the really awesome thing is that if you address these issues, you're probably going to experience other positive side effects as well, not to mention learning to become your own PCP. And that's the best positive side effects. I'm Dr. Gala, and I look forward to seeing you next time.